There are two big dangers associated with receiving a psychiatric diagnosis. Psychiatric diagnosis can be very important as it can guide us to improve the treatment we receive. For example, if for our patients who have obsessive compulsive disorder, learning that they have obsessive compulsive disorder or OCD can help them to choose appropriate books about OCD. For example, to read the book Talking Back to OCD, or reading the book What to Do When Brain Gets Stuck for younger children and young teenagers. So definitely, most of the times a psychiatric diagnosis is helpful, but it's true there are dangers associated with receiving a psychiatric diagnosis, and I'd like to mention two big dangers, because by you being aware of these dangers, you will decrease the chance that you make the mistakes that unfortunately we see several families making. What are these two big dangers of receiving a psychiatric diagnosis? The first one is only focusing on the negatives. It's true that several psychiatric disorders cause lots of suffering for people, like anxiety disorders and depression, but we cannot overlook that there are at times the positives associated with the problems. For example, anxious people are almost always nice people, so anxiety problems are really a problem of niceness. People who worry are almost worry, people who are nice, or they're perfectionists, they don't want mistakes, they want things to go well. So really the anxiety problems frequently come from goodness. Most anxious people are good people. Again, not trying to minimize the suffering caused by anxiety problems. Anxiety problems can cause lots of suffering, but there are positives associated with anxiety problems. There are positives associated with, for example, having some degree of autistic spectrum disorder, and there are strengths associated too with having dyslexia and other psychiatric or psychological disorders. The other danger of receiving a psychiatric diagnosis is that at times when people receive a psychiatric diagnosis, they stop thinking medically. Okay, so what I mean for that? What I mean for that is at times psychiatric problems are caused by medical problems, for example, anemia or thyroid problems. So for example, if let's say a teenager or an adult receive a diagnosis of depression, when you receive this diagnosis, unfortunately at times both we doctors or our patients forget the body, forget possible health problems that could be contributing to that problem. So it's very important if you have problems like feeling tired, low energy, or any other possible medical problems, or even if you're not feeling anything different in your body, you do talk with your family doctor or your child's pediatrician about the possibility of your mental health problems being possibly secondary to medical problems. Most psychiatric problems are not secondary to medical problems, but sometimes they are, and we don't want to overlook these health problems. In summary, psychiatric diagnosis can be very helpful for patients, but there are dangers associated with receiving a psychiatric diagnosis, and the two big dangers that I like to mention in this video are the risk of we overlooking health problems and the risk of we only focusing on negatives. So we don't want to make these mistakes. So that's why I recorded these videos for you. This video is not medical advice. Never change your treatment without talking with your family doctor or your child's pediatrician. I recommend watching the other videos on my channel to continue learning more. Don't forget to review the terms of use of this video in the video description. Thank you for watching.